We want to demonstrate a very high continuous flow rate in the deep venous return in the right sapheno-femoral junction. As you see, there was a Valsalva maneuver done and it stopped the flow, so that proves it's venous, but then it returned straight back to its incredibly high venous return. We're now going to go to live mode. So there is our artery, there is the common femoral artery over there, and right next to it we have the deep venous return. As you notice, the deep venous return is aphasic and continuous. We're now 3 or 4 centimeters lower down from the crease, and we do have a possible connection or just the proximity of an arteriole to the venous return about 4 or 5 centimeters below the sapheno-femoral junction. What is clear though is that we have an aphasic continuous venous return which cannot be explained at this point. We're going to search a little further down in the great saphenous vein and see if we don't find an arteriovenous fistula. This is a finding that we see in between 1 and 20, 1 and 25 patients. We are now 7 or 8 centimeters below the sapheno-femoral junction crease, and we're looking at the great saphenous vein on the right. If we follow it higher up, going caudally, looking at the complex over here, it's not easy to see whether we do have a connection between an arteriole and the vein, which could be explaining the high venous return. But what we do notice is that the deep venous return is very high as it plunges deep into the medial aspect of the thigh. We are following the great saphenous vein down the leg. We're now in the Hunterian perforator area. Just to prove that this great saphenous vein, we're going to use some pressure, and we'll notice that there's definitely reflux, as you'd expect with a varicose vein history. The high venous return has stopped below the knee. Great saphenous vein clearly visible with reflux. Looking at the posterior circulation, we'll notice that there are some perforators clearly visible. But what I'm going to do is ask you to turn your side facing towards Abby, if you don't mind. We're looking in the popliteal fossa, right posteriorly. What we see in the popliteal fossa is a deep venous return with possible varix formation, nice and bulging. We notice that the deep circulation is patent, and I can't find any obvious reason as to why there should be such a high venous return.